May the 31st, 2013. I was watching the NBA championship, fell asleep, woke up to take a shower, and noticed that I couldn't hold my balance and felt a little weakness on my left side. I couldn't really maneuver myself to move around. Then it dawned on me that something was wrong, and I just thought, that I was having a stroke because I couldn't get my balance and I couldn't hold on to anything. And next thing I know, I was at University of Maryland, St. Joseph. I got sent from there down to University of Maryland, shock trauma. I was there for like 3 months. And they sent me from there to University of Maryland Rehab. I was there for a month.
The University of Maryland Rehabilitation Network is really a collection of a diverse group of professionals in rehabilitation medicine, therapists, as well as therapy programs drawn from all of the sister hospitals within the University of Maryland medical system spread across a good part of the state, whose primary intent is to ensure really the very best possible experience for rehabilitation patients anywhere in Maryland, no matter where they enter our system.
We range from acute care, inner city hospitals, all the way through to smaller community hospitals in Maryland.
So it is a consolidated rehabilitation service line that encompasses all the facilities that belong to the University of Maryland system. The services provided in a network that's this large and this comprehensive across the state of Maryland go from A to Z.
We're able to see patients with a wide variety of diagnoses, such as stroke, brain injury, spinal cord injury, multiple sclerosis, Parkinson's, total joint replacements, amputations, and the list goes on.
When I first got there, I couldn't even stand on my own. And when I left there, I was able to walk with a 4-point cane. Then went to University of Maryland St. Joe's outpatient.
I think what the network actually enables us to do is we're able to focus the acute care around the major injury in one site, but then actually we're able to hand off that patient, depending on where they live, to another part of our network somewhere so they can get continued outpatient therapy and other kinds of support in other locations that's geographically more attractive for them.
The healthcare system is very difficult to navigate, and it's scary. And when patients come to any hospital, they trust that you're really going to do the best for them. And the network has allowed Upper Chesapeake and all the clinicians across the system to really feel that they are doing that.
What it has done is has connected the different campuses of University of Maryland. It has connected the large regional and demographic area that our hospitals encompass, and it has made us partners in rehabilitation. It has given us the opportunity to network about our services and service lines, as well as the opportunities to standardize programs.
So we call each other more, we talk to each other more, we collaborate, we network, and we share information more.
Becoming a part of the rehab network has allowed us an opportunity to have that continuum of care from one hospital to the other. And it has been beneficial for all of our patients that have been treated and seen by our therapists.
If after they're done with inpatient care, they really lived further away at a different geographical location, we really strive to hook them up with a hospital that is more convenient and most convenient for them. And I think they feel good about going there because they know that it's the University of Maryland name, and we're going to provide a really sound product for them in therapy.
We have some amazing stories where people's lives have unfortunately undergone tremendous, unanticipated, devastating injuries sometimes, but some of them are actually able to turn around, again, with the research that's being done and the technology and absolutely the care that's provided in our network to really transform their lives and get to a new equilibrium that is very personally satisfying.
Today, 11 months later, I can walk decently. I can go up and down my steps finally decent. A lot of reasons why I was getting better is because University of Maryland really got me through it.
Our primary goal is to ensure the best patient experience, and we always think of that from a very clinical perspective, and that's the most important. How well is the clinical care delivered? What are the outcomes associated with that care? But the purpose of the system also, again, is to make that kind of care as user-friendly, as seamless, as comfortable for the individual as possible, no matter where they are in the state. And our hope is, because our system now has grown quite a bit to 12 hospitals with additional management contracts with other hospitals, that we're going to be able to offer what we're talking about today to more and more people over the next several years in our state.